Hi, my name is Dr. Kalidas. I've been in practice in the Orlando area for the last 22 years. I initially started my training as an internist and practiced at a location down near the airport area, and realized that after 10 years of practice that most of my patients were coming with a bigger bag of pills and seeing multiple specialists. And as a practicing internist, I saw a lot of diabetic patients, but they were not getting the additional support they needed in terms of the nutrients and addressing their diet more adequately. So I left and sold my practice back in 1998 and spent 2 years of training as a naturopath and got an additional degree as a naturopathic physician in Portland, Oregon. And that really gave me an insight into both nutrition, the lifestyle choices that we make, and how it impacts our health.
2 years ago, I was diagnosed with what's called myelodysplastic syndrome, which is a pre-leukemic condition. I've had 28 blood transfusions, and I was just about to give up. I have tried so many different things. I had nowhere else to turn. Someone had recommended Dr. Kalidas to me, and when I first met him, the first thing he did when he looked into my eyes was grab my hands and pray, and said to me, "Don't give up. You have to have hope. You have to keep going on." He put a curriculum together for me. I've been doing it for 8 weeks now. I do feel better. I have a lot more energy, and I feel that I am on the right path.
My current focus is also towards improving nutritional health, and as part of our services that we provide, we can analyze your blood to see what type of nutrient deficiency you might be having. We also have a blood test available that will predict your risk for diabetes for the next 5 years. So by simply looking at some numbers, and if you have a family history of diabetes, and if you're looking healthy, what's your risk of getting diabetes, we can predict that for you. After we establish the diagnosis, what's the best means possible to, one, decrease the risk for the long-term complications that we all fear about with diabetes. Everything from both cardiovascular health, as far as increased risk for heart attacks, or problems with the circulation in terms of strokes, or peripheral vascular disease, which result in amputations, which is one of the major cause of amputations in the country.
Hi, I'm Lindsay Sutherland. I'm one of the nurses here at the Center for Natural and Integrative Medicine. Prior to this, I've worked in the hospital, and I couldn't identify with the doctors just giving band-aids for reasons for patient symptoms. And working here, I can guarantee I will never go back to the hospital, because what we're doing is far more than just slapping a band-aid and sending people out the door. We're actually finding the reason why people are sick and addressing that. And once you address that, you're able to then take care of everything else along the way.
As far as the IV support, by actually testing your blood, we can find out what deficiency you have, and based on that we can come up with a protocol specifically for you that you can take on a daily basis as far as supplements. If there's a need, we can even give you things like intravenous glutathione or high doses of vitamin B vitamins. We like to optimize the GI health by giving appropriate digestive enzymes, because we do have to realize that your digestion is just as important in terms of the ability to break down and absorb your healthy fats. And 1 out of 10 Americans have their gallbladders taken out. So what are you doing as far as your fat-soluble vitamins, and also how is it affecting the way that you're absorbing your daily vitamins? The IV protocols can also be specifically designed for things like macular degeneration, and to decrease the proliferation by supporting the antioxidant functions. So we do high doses of vitamin C and antioxidants to support those patients with diabetes as well. I want to be remembered as a physician who fulfills the role of a physician. A physician is the word is also means teacher. So you have to educate your patients, just as Charles is. You are educating people about the implications of diabetes on health and longevity, as well as the effects on overall eye health and all the facets of where diabetes affects one's health. I'm looking at it more from a larger perspective also in terms of chronic health. where they failed a traditional MD health approach. What can we do on a day-to-day basis from a functional side, whether it's addressing the toxins, hormone, infections, nutritional status, or their sleep or stress or anxiety? How do all of that play a role in their health? So my goal is to educate as many people, turn those patients around who've been struggling for a long time, and with the book that I'm writing, hopefully to make it out there and make it known that you do have a choice out there. Don't get stuck with a diagnosis. It's not over till it's over. Let's fight, and let's fight together.